So I'm Nikhil Munshi. I work at Dana-Farber Cancer Institute, and we have a number of presentations here which focuses on understanding how the myeloma initiates. And I think over the last couple of years actually, all the advances in genomics have brought about greater understanding of how myeloma starts. So in one of the work that we have performed and presented and now almost published is on how the evolution of myeloma happens in the chronological order. And what we have identified is that the copy number changes we see are very early events. We see trisomies involving chromosome 3, 5, 7, 9, 11, 15, 17, 21. Those trisomies are present in myeloma, they're present in smoldering myeloma, and they're even present in MGUS. And so they're very early events. And then we looked at chronology, which trisomies appear first. And we have realized that trisomies of chromosome 9, 15, and 19 are the very first event. That's how myeloma probably starts, as MGUS, and then it persists all throughout the course. Now this is half of the myeloma, what we call hyperdiploid myeloma. The other half of the myeloma has a translocation involving chromosome 14. And those translocations are also very early event. That's how MGUS starts and then progresses to smoldering disease and progressing to myeloma. And so because these fundamental cytogenetics copy number changes happen very early, the question happens that what causes myeloma then? And so we're beginning to think that myeloma is probably driven by more specific genetic changes, more changes related to oncogenes and anti-oncogenes. So the mutational changes might be important. And we have identified a number of mutations, and others have, involving RAS, RAF, MAP and ERK pathway, some of the NF-kappa B pathway. And these mutations might be driving part of the disease. And then the third component is that some of the expression changes, which may be identified through bigger whole genomic analysis and RNA sequencing. So one of the papers presented by one of my colleagues, Dr. Samur, looked at the whole genome sequencing data in a large number of patients, and he has identified that some of the mutations are present in 70+% of the patients. They are very recurrent and may be playing a very significant role in development or progression of myeloma. One of the genes is BCL7A, the other one is BCL6, and we have a presentation on BCL7A suggesting that loss of BCL7A may be driving the ultimate progression to myeloma and how the disease behaves. And that's very important because one thing we understand the biology, but in doing so we can also find newer methods for treatment and newer targets for treatment. Similarly, our whole genome sequencing data has also identified some of the other newer elements called link RNA. Now link RNA, again determined through RNA sequencing, are these very unique ill-defined RNA molecules which seems to have a very significant role. And one of the link RNA we just described is called link 1792, or we call it RR-role. It works through lipogenesis and affects myeloma growth. And when we block that lipogenesis by an inhibitor against a molecule called ACC1, we can really kill myeloma cells. So this metabolic pathway may be playing a very important role. So we are now better conversant with what causes the early disease. We are beginning to know or understand the initiation of myeloma. And another component is epigenomic changes, which may also drive the disease. And I think we have some interesting finding on those, that what epigenomic changes might lead to perturbation of transcription factor, leading to expression changes, etc. So I think we are beginning to understand the puzzle, developing some therapeutic applications using various inhibitors to various disease targets.